In our modern world, so much of our experience is physical, dealing with the day-to-day pressures of life on the run. Some of us, however, have discovered a way to diffuse the stress and stimulation of life.
Meditation can be a whole lot of different things to different people, but often it's a way of quieting the mind. Some people would say it's learning to live in the present moment. Very often we're very past-focused or future-oriented, and we don't really catch the moment as it's occurring.
The idea of setting aside time to calm the mind and truly live in the moment is foreign to many of us, and yet you've probably practiced some form of meditation without even knowing it.
I think of somebody who's knitting a sweater or doing a petit-point picture. You're slowing yourself down.
As long as we're awake, we can meditate, whether we're walking, whether we're swimming. It's simply just being present with what we're doing in the moment. We don't have to be formally meditating to meditate.
When I see people fish, I sometimes laugh to myself and say, well, that's a kind of a socially acceptable way of being a little bit quieter with ourselves. It's really being with ourselves is what meditation is about. We're really quite unfamiliar with just being with ourselves. I heard a quote once, which I thought was really helpful. We are human beings, not human doings. And I think that that's really what the goal of meditation is to tune into the being part of ourselves, as opposed to always be busy doing things.
While there are many techniques, there are two basic approaches to meditation. One is called concentrative meditation, in which we focus our attention on one specific thing while excluding everything else.
Concentration is the beginning post for meditation. It's the beginning of that discipline, which is quieting your mind. And certainly meditation is active. It requires some amount of effort. It doesn't necessarily happen spontaneously.
Often when people think about meditating, they don't really see how it would be possible not to have thoughts going on in their head. So it's really a matter of actually just sitting down and doing it.
We could focus on a flickering candle or other light source, a sound such as a chant or mantra, or something as simple as our own breathing.
Very many of the meditation techniques incorporate a focus on the breath awareness, sometimes shaping the breath, focusing on the inhale or the exhale. So that would be a very simple, concrete place to start with someone who's had no experience with this.
Try this simple exercise. Find a quiet place and make yourself comfortable. You can lie down or sit, keeping the spine straight and shoulders relaxed. Breathe naturally, but focus on the feeling of the in and out motion of your stomach. Your mind will wander, you can count on it, but that's okay. Every time that happens, take a moment to pinpoint what is distracting you, then consciously bring your focus back to your breathing.
Meditation does require a certain amount of perseverance. It's like when you're learning a new dance step or you're learning a new, something physical or a skill like piano playing. You don't get it right away. It requires some effort and some practice.
Another approach to meditation actually uses all of these distractions to our advantage. It's called mindfulness meditation. Instead of narrowing our focus, we widen it to include the full spectrum of thoughts, feelings, sights, sounds, and sensations. We simply allow our thoughts and feelings to come and go. We don't try to control them, but we don't react to them either. We're simply on the sidelines, watching them go by.
Being in meditation means you're really being with yourself in a new way, warts and all, not just the good parts of yourself, but you have an opportunity to really look at yourself in ways that you wouldn't normally.
That doesn't mean you always have to sit to meditate. Tai Chi and Qigong are forms of meditation that focus our awareness on the slow, controlled movements of the body. Even the act of walking can be a form of meditation.
Often in our everyday lives, we're walking for the sake of going somewhere, and we may be thinking about this or thinking about that or planning or whatever. And so with walking meditation, then we're focusing on our steps, on our contact of our feet with the ground, and keep on coming back to that as the anchor of our attention.
Controlling stress is one of the main benefits of meditation, and the effects it has are as much physical as they are emotional. Heart and respiration rates slow down, body temperature drops, and the brain waves change. It's not sleep, but a kind of restful alertness, which can improve perceptual ability, reduce high blood pressure, enhance the immune system, and manage pain.
Meditation can be a tremendous gift in just basically facing what comes up in our lives. We begin to see that life is made up of the joys and sorrows of life, so that when we're dealing with health problems, then it begins to become part of life and not something that's gone wrong. So it provides a framework to understand when we're dealing with difficulty. It allows us to be more conscious in our lives, to be aware of what's going on within us, to be more aware of our environment, relationship to other people, and our relationship to life.
It certainly doesn't need to be a lengthy time, but it's the regularity of practice, maybe setting aside a certain time of the day that you practice, just like you would with maybe an exercise program. That's a way to get that discipline, and often that's when you start to see and feel the results for yourself.
Since the moment I started meditating, I realized that it was really a way of finding answers to questions that were very important to me, finding more peace with myself.
I think it's a real gift to learn how to attend to one thing, you know, as it's happening. For instance, learning how to eat an apple and to just eat the apple, to taste it, to feel its texture in your mouth. That can be meditation.
Of all the tools we use on a daily basis, our hands are the busiest. No matter what the job, our hands and wrists are put to the test, often with tasks that are repeated over and over and over again.
With its increased use over the years, the computer has been linked to a condition that's becoming more and more of a health problem, carpal tunnel syndrome. But the computer isn't the only culprit.
Piano players, massage therapists, people who work at cash registers, people who cut hair, a lot of flexion of the wrist in their jobs often suffer from carpal tunnel syndrome.
The carpal tunnel is a narrow passage in the wrist made up of bones, tendons, and ligaments. The median nerve runs through this tunnel to the palm of the hand, providing sensation and strength to the thumb and first 3 fingers. Repetitive motion, especially that which involves gripping and wrist flexing, can cause swelling of the muscles and tissue in that area. Inflammation puts pressure on the median nerve, restricting blood flow. Early symptoms are a tingling in the palm, thumb, and fingers. But if allowed to continue, they can give way to severe pain and loss of strength. Pain may also radiate up the arm to the shoulder and neck.
The first thing that usually starts to happen as the carpal tunnel syndrome gets bad is that the person will start losing sleep. They'll wake up between 2 to 6 times a night, and they'll have to get up and shake their hand off because it'll be numb and achy and painful. Over the last 10 years, the frequency of carpal tunnel syndrome has doubled. So it's a very big problem right now for a lot of people, and it's a very big problem in the workforce.
Carpal tunnel syndrome is not always work-related. It is generally more common in women over the age of 35 and has been linked to the onset of arthritis. Glucosamine is an important nutrient in our cartilage, and as we get older, its levels decrease, causing joint stiffness, pain, and swelling.
Fortunately, only 1% of people with carpal tunnel syndrome will develop permanent injury. Although it can sometimes take months to heal, if diagnosed early, surgery can usually be avoided. Often, the first stop in treatment is the chiropractor.
Chiropractic treatment often includes some kind of splint or brace that immobilizes the wrist to minimize or prevent pressure on the median nerve.
I specialize in a treatment called active release techniques. It's a new soft tissue treatment that was developed by a chiropractor in Colorado, and it specifically is designed to release adhesions that form between muscles or between nerves and muscles. If you have a healthy individual that has got a good diet and they're fairly fit, then ART usually will do the job. If you have someone that has a very poor diet, their fitness level is very poor, then it'd be very important part of the treatment is to have them improve their diet, improve their nutrition, and have them start an exercise programs.
Since carpal tunnel syndrome is sometimes linked to a deficiency in vitamin B6, nutrition should start there. Excellent food sources of B6 include cabbage, spinach, and carrots. You can find nutritional yeast and raw wheat germ at your local health food store. Both are good sources of vitamin B6. Wheat germ is also a good source of magnesium. A deficiency in this important mineral has also been linked to carpal tunnel syndrome. You can fortify your diet with B6 and B2 supplements. Evening primrose is the best source of gamma-linolenic acid, an essential fatty acid that acts as an anti-inflammatory. Glucosamine supplements can help rebuild damaged cartilage as well as providing relief from pain.
Rest is one of the best remedies for carpal tunnel syndrome. Changing the person's working environment, for example, having them use a ergonometric keyboard rather than keeping their wrists in this position when they're trying to type. There are also different ways that the wrist can be stretched that can help to relieve pressure on the median nerve.
The number one prevention for carpal tunnel syndrome is to do regular stretching. If you do a job that requires you to do a lot of computer entry, or if you play an instrument, that puts you at a very high risk. If you're working in a job as a mechanic or a plumber where you have to use a lot of high pressure to every day to get your job done, then you should probably stretch every half hour.
One simple exercise is to circle your hands at the wrist, which helps restore circulation and get the wrist out of the position that can cause symptoms to develop.
Another is to gently open and close your fingers, holding them open in a good stretch. Repeat this a few times throughout your working day.
But remember, before using any of the remedies we've talked about today, make sure you get advice from a qualified healthcare provider. Natural methods of healing work best when they're part of a holistic approach to every aspect of your life and lifestyle. And please join us again next time as we journey together to a place beyond medicine.